Okay, we're good to go. Hello, everyone, and welcome to Cascades Analytics Live. Sorry. I'm Alexandre Stepanovic, founder of Cascades Analytics, a New York-based media and consulting bureau focused on the therapeutic revolution driven by psychedelics and neuroplastogens. Every week, we go where the action is, speaking with the leaders, founders, scientists, and investors, shaping the next generation of psychiatric drugs and mental health therapeutics. Today, I'm thrilled to host Sonia Weiss, co-founder of WPSS Bio, an investment fund that has backed some of the most influential companies in this space, including Gilgamesh, Delix, Compass, and Atai Beckley. We're going to talk about how scientific readouts from inform investment strategy, what counts as a strong signal, and where the most interesting early and late stage opportunities are emerging in psychedelic and psychoplastogen biotech. Hi, Sonia. Thank you so much for joining us today.
Hi, Alexandre. Thank you so much for having me.
So my first question is, how was WPSS Bio funded? And what was your main investment vision at the time, and how did it evolve?
Yeah, so at the time we started WPSS Bio. It was my brother and I. We started it because we were deeply impacted by mental health issues in our family and in our immediate circle. And we really wanted to find ways that would get to the root cause of the pain and really try to heal from the root rather than just deal with the symptoms. Initially, we started doing some SPVs and doing some personal investments in the space. But when we realized the potential, that's when we started fundraising more broadly. We funded primarily from family offices and high net worth individuals. And I would say what they had in common for the most part was a conviction. They had been impacted in some manner by mental health issues, or had been positively impacted by a psychedelic experience. I would say those are the two common denominators in most of our investors. And yeah, it basically grew from there.
Mm-hmm. So you would say it's based on the psychedelic renaissance that
we did start with the psychedelic renaissance. I would like to mention we're not solely focused on psychedelics. We realize that there's a huge amount of therapeutics, a huge amount of approaches that can be applied. So our approach is much broader than just psychedelics, even though we think psychedelics are hugely impactful.
So mental health as a global mission?
Mental health, central nervous system health. But yes, so I would say mostly mental health. We have done some opportunistic investments in CNS that go a little bit beyond just mental health.
Mm-hmm, mm-hmm. And so how do you decide between investing in psychedelic compounds or, next gen neuroplastic psychoplastic drugs? How do you decide to go with the hallucination ones or, without? Or is it something that evolved along the way?
I think we've done both types of investments. I think both have pros and cons. Known psychedelics, the psilocybin, LSD, 5-MeO, etc. We know they work, right? There's plenty of real life evidence that they work. They are, with proper medical screening, they're known to be safe. They have huge effect sizes, especially when coupled with therapy integration. They're incredibly effective, but they're known. So IP is not as strong, and you're still and there's still a lot of stigma around them, as we saw with Lycos. And they don't fit neatly into a pharma approach. They're not a pill that you take every day that just your psychiatrist prescribes. It's a completely new model. Neuroplastogens, on the other hand, there's more science risk. We don't know. I mean, even though they might be inspired by molecular scaffolds of known psychedelics, there's still unknowns. So there's more science risk. But if they work, there's more IP, and they fit more neatly into a pharma model. So our approach is diversification. We've done both. We were enthusiastic about both. We think both in healing and in the market, there's room for both. So we don't favor one or the other. We measure the risk and benefit of both and invest in both.
Mhm. And how early are you comfortable joining a project? Is it just at discovery mode or preclinical, first in human trials?
So we've done
What?
everything. We've done it discovery, we've done preclinical, we've done human trials, like just phase 1 trials. I would say a lot of lessons were learned. Discovery is very risky, and in an environment where interest rates are so high, investors are not really willing to take risks that are that high. So going forward, and then we wouldn't do probably just discovery. Maybe if there's a discovery platform, but there's already some assets that are farther along, that could be interesting. But purely discovery, we found it's too risky, especially in a high interest rate environment. We have done plenty of preclinical, and we do have, and we like human trials. Obviously, always depending on valuation and how. But I mean, the farther along you go, the less risk you have. So it's always that trade off.
Mhm, mhm. So let's dive into the science a little bit and the risk. What kind of early evidence gives you the most confidence, for example, in preclinical? Is it animal data? Is it receptor biology? Um, Signs of real plasticity, the biochemistry, or
So
what readouts do you like to
So
handle?
we like real life evidence. So we like botanically inspired molecules. We also like molecules that, in a very old school way, have been tried in humans, even though, like, and nowadays regulation doesn't allow that, even though it might happen a little bit um, informally. But we do like real life evidence. We do like drugs that, whether it's because through the racemic mixture, they've been tested in humans, whether it's botanicals that have been used by humans for a long time. That's our favorite. If we have to go purely by assays, I would say I really like looking at dendritic growth or some sort of neuroplastic markers, especially like in pyramidal neurons, or a rise in some neurotrophic factor. So I definitely like to see some markers of neuroplasticity. I don't like to go receptor specific or receptor engagement. That's too limiting for me. That's not something that I look at or with any type of significance.
So the plasticity is what you want to look at. Do you look at any type of markers for biochemical markers like PSD95 and things like that? Any biochemical assays, or mostly by microscopy and dendritic growth?
But microscopy primarily.
Mhm, mhm,
Yes.
mhm. Um, so how do you judge whether results in animals will actually translate to people? Since you mentioned
Um,
you invest in a lot of preclinical stage.
yes. So again, I don't know if you've seen this joke of what a happy and a sad rat looks like. It's exactly the same.
Right.
And only about 7% of drugs that reach humans, that reach phase 1, actually make it through to approval.
Mhm.
So translation, as we all know, is it's a little bit of a shot in the dark,
Mm.
and hence our emphasis on drugs that are botanically inspired or inspired in real life evidence. because even though we do look a little bit at translation, especially around safety, in terms of effectiveness, most of the animal data is, I mean, it's hard to come by, especially on the effectiveness side. And the like the head twitch, like you can see if it's hallucinogenic or not. You can see if it's safe to a certain degree, but the effectiveness, I think, is still quite imperfect.
Right, it's hard. How far can you go in investment based purely on preclinical data? I mean, it's hard to go full on, I imagine.
Yes, we have a hard time going. We have done it. Again, we've done it primarily in drugs that are botanically inspired or inspired on real life data. And if alternatively, I mean, it's not scientific markers. And I say this because we don't, in terms of effectiveness, we see it as a way to get IND, but we don't. There has to be more than just animal data for us to go forward with a particular investment in a preclinical stage.
Yes, I mean you've backed some of the most successful until today. We'll see how the phase 3 goes for each one, but Delix, Atai, Compass, Gilgamesh, these are fantastic projects. So did you start investing in them from the preclinical stage or along the way?
I can go by one. Compass, we invested around phase 1. Again, it was psilocybin. We've been using it for thousands of years. Delix, we invested from discovery/preclinical stage. It was first in class. It was also inspired by molecular scaffolds of known botanical drugs, and we thought that the research that Olson was doing was quite Dr. Olson was doing was eye-opening and insightful, and it was the first time we saw any research like that. There have been a few that have followed through, but we do like to focus on either first in class or best in class, and Delix and the research that Dr. Olson was doing just blew us away.
Right.
So, and then Atai had a portfolio of known compounds and was developing those. So some preclinically, but with some human data that had been available. And then in Gilgamesh similarly, right? Like the DMT, they were doing ibogaine, they were doing drugs that, again, lots of known human data.
And do you prefer companies with a deep focus on one mechanism, or those testing their compounds across several conditions? Or does that not matter?
I mean, as we know, like psychiatric indications are quite heterogeneous, and symptoms may not be the result of the same underlying biology, and the underlying biology might actually have a great variety of symptoms across diseases. So in terms of like getting approval and going through the process, I think it is important to go through these like definitions of disease. But we do like increasingly more companies that are trying to focus on the underlying biology more than the symptoms that emerge from that underlying biology. So we are looking more closely at tools that try to segment the population, either based on EEG readings, fMRI readings, behavioral biomarkers, just really trying to understand and segment the population more precisely, and focus on that rather than focus on the DSM-5 symptomatology.
And when many companies claim, non-hallucinogenic neuroplasticity, I mean, there's just been another paper in Nature this morning. It seems that it's really the way to go to nature now is to have a non-hallucinogenic neuroplastogen. But so how do you tell who's really different and who's really, you know, worth a look?
So we've only ever invested in Dalix within the neuropsychoplastogens. Again, they were first in class, and we believe probably best in class given Dr. Olson's history in this space. That doesn't mean the others aren't great. It's just we only ever do first in class or best in class, and we believe Delix was both.
But you didn't decline any other. I mean, maybe not. You don't want to disclose that, but
we were approached by several others, but we declined to invest.
Based on
And
this.
not based on anything that's wrong necessarily with them. It's just we were already with Delix. And I think it's also important to, this goes back to our financial risk assessment.
Right.
We try to do our approach to dealing with risk is having, it's based on Andrew Lowe's portfolio theory. We try to have a very diverse, uncorrelated portfolio. Just because science risk, especially at a preclinical stage, is so hard to measure. So by having basically Delix and all their portfolio, we didn't necessarily want to invest in other companies that were targeting similar mechanisms.
So when a company says its drug works fast, what proof do you need to believe it? What are the readouts you use and you like to rely on?
I think mostly what we've seen is human data. In preclinical data, it's hard to measure, and what we like to look at is similar to what we saw with R-ketamine. It is within the first 2 hours a drop in the primary symptoms of depression, anxiety, or whatever it may be. I think Spravato has been, I mean, other than racemic ketamine, but like let's say FDA approved for these indications, Spravato has proven to be very effective. I think now there's a lot of rapid acting antidepressants on the pipeline that have not been approved but would be approved. I think right now the focus more than this rapid acting is more on like have it be rapid acting and durable. I think that's something that for the RADs hasn't necessarily been a focus, but I think going forward and the next gen should focus also on durability, not just it being rapid acting.
So a little bit about regulation and then the clinical path. What lessons do you take from the MDMA, Lykos's MDMA and the esketamine examples, which are two very opposite
yeah, two
stories,
very opposite stories.
but they
so
kind
Spravato,
of
yes. So I think Spravato, they followed a regulatory path. I mean, being JJ, they knew what the FDA wanted. They didn't cut corners. They provided both the positive and negative side effects. They disclosed absolutely everything, even the sites in Poland that maybe were outliers, but didn't show significant differentiation versus placebo. So I think they were very transparent in their whole process. And I think that was very helpful for them. And I think it being J&J, I mean, that just within the structures of the FDA, that just allowed them a foot forward that Lykos didn't necessarily have. I think Lykos, just being Lykos and emerging from apps, already came with a lot of stigma. And I mean, I don't necessarily think it's justified, but it's the reality. They already had a lot of stigma and they were perceived to be somewhat cultish. From MDMA, my main is one, you can't cut any corners. If the FDA requires you to have all the talks, you need to like have every single study that the FDA requires. You need to be fully transparent with regards to everything that's happening in your trials, both positive and negative, and fully disclose everything. You need to both. I think it's important to say that you need to disclose both the positive and negative side effects. I think there was a lot of focus on very limited negative side effects, but the positive side effects, which we might see as part of the therapy, I think it was also important to disclose those as a side effect. I don't agree with this, but I think given the FDA structure, I think it's important. I think therapy coupled with these drugs, it will make them far more effective. But the FDA, the reality of it is it's not structured to evaluate therapy. So if
Mhm.
you can first isolate just the effect of the drug, and then once it hits the clinic, some like trust that it will be coupled with therapy. I think given the current structures, that could be important.
Mhm.
Um, de-emphasize a little bit the therapy, even though in a real life setting, I think therapy is incredibly important.
Mhm.
The FDA is just not structured for that. And I think lastly, it's important. I mean, IP is important. I know a lot of people don't like to hear this, but IP allows you to be well funded. And when you're well funded, I think you're less likely to cut corners and you're more able to like move fast and run the trials uh, in a more in a quicker way. Um, which I think Lycos, I mean, I'm incredible. I respect what they did. I think it's amazing how much money they were able to fundraise. I- If they get approved, I think it'd be wonderful to have MDMA at a cost uh and at a manageable cost. Like I fully support the vision. The reality was they've had a lot of liquidity problems because of this approach. So in an ideal world, this shouldn't be necessarily. In the current world, I think it is.
Yeah, and to give credit to Rick Doblin, he carried that dream of having
Oh my God, Rick
a
Dublin is
psychedelic drug, approved back in 80,
80.
early 80s. Uh,
Yeah.
and that's where everybody was, he was loved at. And now
I mean,
he's
he's a visionary. We wouldn't be here if it wasn't for Rick Dublin. And
exactly.
as I say, right, like I think MDMA should legal. I think MDMA is incredibly impactful. The data is all indicative of the huge effect that it has. Like his
Mhm.
vision was not wrong. It's just the reality on the ground was not ready for it.
Yeah, yeah, yeah. So about insurance coverage now, which is another big topic for psychedelics, and how much do you think will insurance coverage and real-world data shape who succeeds commercially?
I think as we see from esketamine, insurance is incredibly important.
Right. Because
Racemic
that's it.
was readily available for the last 10 years, but I mean, I really Spravato, I think in 2025 is gonna have over $1 billion in sales. Um, and I don't it's not because it's more effective than racemic, it's just because A, the medical establishment now has the data and is able to actually um, prescribe based on FDA standards and not just testimonial data or small studies.
Hmm.
And insurance is now covering it. So I think it's incredibly important. It's incredibly important for broader access to these drugs. It's incredibly important for for getting rid of the stigma. It's incredibly important for KOLs to get on board. It's incredibly important. So I do think FDA approval, insurance, and getting insurance on board is going to go a long way to getting these to be widespread interventions.
Hmm. If we look into the market now, what key moments do you expect in this market over the next year or two?
So some of the ones we're most excited about, I think one is Compass. I think I'm hoping for approval early 2027. They're definitely I'm very much looking forward to their phase 3 trials.
Mm.
I think they're gonna be historically important.
Mhm.
Um, I think Delix readout of the phase 2b, probably late 2026, or I don't know, they don't really they really haven't announced.
Mhm.
Um, I think as a first psychoneuroplastogen, that's going to be incredibly exciting to see a large human study on using neuropsychoplastogens. Um, and then I think there's going to be some smaller, so like we're invested in a company called Serotype that uses fMRI to separate responders from non-responders and really understand what's happening in the brain of one and the other. And I think they're going to come out with some very interesting data based on some combination drugs, and I think it's going to be exciting for the precision psychiatry space, and just having the use of biomarkers for understanding how these drugs act in human populations.
Mm-hmm. fMRI designed to measure psychedelic action, or
They're right now they're focusing more on understanding on understanding the signals that separate responders from non-responders. They really haven't delved deeper into the mechanism of action. But even just that, in terms of prescription, I think is going to be incredibly powerful to understand who should be getting these drugs and who shouldn't, and at what doses, right?
responder to SSRI?
I'm to different drugs. I can't
Or
say
different
the
drugs?
drugs that.
Oh, okay.
Yeah,
Yeah. I wasn't sure responding to what. Okay, just to prescription drugs, so psychiatric drugs. Got it. Yeah.
just it's confidential, but they're doing some
Sorry.
interesting trials around
Okay. Sorry.
drug delivery.
I see. And so, what signs do you think would show that investors are warming up again to CNS innovation and psychiatric drugs?
I mean, I think money talks, right? Like if investment starts flowing back into the space, that's important. If there's M&A activity, that's important. If IPOs start again, that's important.
Mm-hmm.
So I think it's really just following the money and seeing if I do see money starting to flow back in the space at more reasonable valuations.
Mm-hmm.
It is not the boom that we saw maybe in 2022,
Mm-hmm.
2021, 2022, but I do, especially for the more serious companies, I am starting to see money flow back into space, just at lower valuations, not at the valuations that we were seeing a few years ago.
Mm-hmm. It's going to catch up.
And some M&A activity. We haven't seen IPO activity, but hopefully some IPO activity we'll see in the near future.
Mm-hmm.
And I think that will reignite the space again.
So my next question, actually, your portfolio is a great example where we have you invest in psychedelics and neuroplastogens, but also for different tools. And do you think these new data tools and digital biomarkers that could speed up drug development? Do you see any room for that? Potentially a synergy within your own companies in your portfolio?
So what type of technologies are you referring to?
Just for example, the fMRI, or I think there is also you have a company developing small implants. I forgot the name of that company, but it looks like you're developing. There are some companies developing tools for the CNS, and I'm just wondering if you think about a synergy between those companies and use of.
Yes, so I do think there's a lot that we can elucidate from the population based either on fMRI,
Mm-hmm.
EEG in certain instances, although EEG, it has to be a very clear signal. EEG is a little more dirty, but behavioral insights, I think behavioral insights can be incredibly interesting, and just, we're in a company called Kasana that does passive sensing, like continuous passive sensing, using a variety of variables and digital phenotyping and just-in-time intervention. And I think that all these tools will help better understand what's happening with the patient and better understand who's going to respond and who's not going to respond to these interventions, and in what instances will they respond.
Mhm,
So all these things I think are going to be incredibly informative,
mhm,
both in terms of drug development as well as once it hits the clinic,
mhm,
as in terms of prescribing and in terms of how to actually treat patients.
mhm.
Um, I do think there's huge partnerships, and it's already happening. For example, Kasana is already working with Gilgamesh, and other pharmaceuticals. So I do think there is a huge potential for synergy and for joint development. And I do think it's going to make the drug development process better, and I do think it's going to make drugs the clinic better.
Mhm.
It's just going to make it better.
So was it your vision, or I mean, your brother and your vision to develop an ecosystem like this?
Um, When we started, I think we were learning. We didn't realize the full potential of what was happening. I think the farther we started understanding what was happening, we did want to develop an ecosystem. We did want to develop relationship between our companies, especially when a clear benefit would be given to both sides
Mhm,
and a clear benefit would occur at the clinic. And I do think it's something that we favor and we like to see in our companies and in our portfolio more.
mhm. So you would be more keen to invest in a company if you could see potential synergies within your existing uh, in the existing portfolio. That's interesting.
I I don't think okay, let me rephrase. I don't think it's something it would tip the balance. It's not what would define whether we invest or not.
Got it. Yeah, yeah. What do you think will separate the winners from the rest in this new wave of psychedelic and neuroplastic medicine?
So I think we need to separate this into two areas. One is execution and one is science.
Hmm.
I think in execution, we need well-funded companies. We need very professional teams with a lot of experience. We need well-designed clinical trials that have like good site selection, that have good patient selection, that have good monitoring. Uh, so on the execution, I think it's quite important. I think in the beginning we didn't fully understand how important this was, and I think this is key in differentiating winners from losers. I don't want to call them losers, or from people who might not get to approval. And then on the science side, I mean, we have all these again. It's I think you need good scientists. I think you need real life data. I think you can use a lot of the tools that are available, especially if you're in a preclinical stage. Maybe you can use some organoid research or some more novel ways of understanding how um, these drugs interact with human tissue. On the clinical side, you can use some of these like EEG, fMRI, behavioral insight tools. So I do think there's a lot of innovation that can happen and a lot of understanding of the human body that will separate winners from losers. Another one I really like is biomarkers, and this is something that Delix is using biomarkers that separate people who metabolize the drug quickly from those that don't. So that also helps with dosage. Also helps. So like really understanding tools that really help you understand the population at a much more granular level. I think will provide quite interesting data and quite interesting results going forward.
Mhm, mhm. Um, so what keeps you most excited and or most cautious about the space right now?
So I think the trials with Lycos were very elucidating. It gave a lot of caution. It also informed the space a lot. Again, I think it should have been approved. It wasn't, but the fact that it wasn't allowed other players to improve their clinical design. So that is both cautious and exciting. Especially on the psychedelics or pure psychedelic side, I think there's a lot of hype, and that hype often
Deflates?
shadows.
Oh, yeah.
So there's like there are known risks, there are safety risks. You do need great medical screening. You do need people to understand that maybe they're not going to have this life-altering experience the first time they do it and be cured, because I do think there's a lot of very hyped expectations, and I do think the potential is huge, but people who maybe don't reach these levels and are like end up being more depressed. And I mean, this is just my personal, I do think integration and therapy is important, especially when you have these very difficult trips that could be incredibly healing, but if just left alone, could be re-traumatizing. Um, so even though the FDA, even though I said you should, for the FDA approval, decouple maybe the drug effect from the therapy, I do think it's important to keep focusing on finding the root cause, on healing the root cause. I think these drugs, whether it's psychoneuroplastogens, whether it's psychedelics, or whether it's, I don't know, neurofeedback or any of these like other interventions, I think they're incredibly, even SSRIs, right? I think they're incredibly useful. But if you don't get to the root cause, if you don't provide healing through connection, if you don't provide nature, nutrition, and therapy, and all these like more integral healing tools, I think their duration will be short-lived.
Mhm.
So that gives me both hope and caution.
Mhm.
But yeah, I mean, my North Star is getting to the root of healing, rather than just cover up the symptoms.
So how does molecular psychiatry align with a more holistic approach to healing? I know you're interested in a more holistic healing than just taking a pill.
Yes, so I think taking the pill, I mean, sometimes it's life-saving, sometimes it's exactly what you need to stabilize.
Mhm.
Sometimes it's what you need to maybe get to know yourself better. But in the end, I think the pills are just catalyzers, and they need to be coupled with therapy or with neurofeedback or with um, other tools that foster connection, or with and I'm talking about depression. I'm not talking about schizophrenia or some of these other, I'm talking about the diseases that are PTSD, OCD, that could be treated with psychedelics and psychoplastogens. I do think that everything else, everything else I'm talking about, which goes way beyond what I'm talking about. It could be acupuncture, it could be um, I don't know, movement therapy. It could be like whatever feels right for the person. I do think all of that is incredibly important for having this like durable effect and for really getting at the root of of healing, rather than it just being a temporary respite or a temporary relief.
All right, great. Thank you so much, Sonia, for your time, for
Mhm.
your questions. Please stay with me just 1 second before I wrap this up.
Thank you so much.
Yes, you're welcome. Thank you, everyone, for tuning in, and don't hesitate to write me on LinkedIn if you have any questions about this conversation. And be well. I'll see you next time on Cascades Analytics Live.